Which intestine do you want to have? I'm Dr. Mona Fahoum. We have a little demonstration. It's going to get a little messy. Why do we want fiber? This is an example of your daily intake of fiber. We want about 25 to 35 grams of fiber in a day. Beans, legumes, nuts and seeds, all your fruits and vegetables. Help with good elimination and a daily bowel movement, and help with blood sugar, cholesterol, and general health and immunity with all these different colors in here, antioxidants, you name it. This is going to provide that. And then we have an example of, unfortunately, what's all too often called the standard American diet. Soda, nice combo meal, right? Well, what happens when you eat something like this versus something like this in your daily diet? Besides the fact that this is probably over half of your daily caloric needs in one place, it also is basically devoid of any fiber or good food for your gut bacteria. So that we have a demo, we're gonna pretend this cut up nylon stocking is your intestine, right? It's a tube, you got your mouth, you got the other end of the tube where we're gonna eliminate, and you've got the tube, the whole tube in between where we're absorbing and digesting and all of those great things. Kind of like a nylon, it's a semi-permeable membrane, so our bodies can take in nutrients through the wall and leave other junk inside the tube. What happens when you eat lots of fiber and lots of fruits and veggies? We're gonna throw some of these through here. Oh, look at that. They kind of just go right on through the tube. Throw some berries in there. Of course, you're gonna chew your food. This is an example. But look, fiber, veggies, fruits, they're all just gonna slide on through. While that fiber is going through there, it's binding up blood sugar, it's binding up cholesterol, it's binding up hormones that you don't need anymore. It's binding up all the toxins from your liver that are getting dumped into your intestine to get cleaned out of the body. And we're leaving a nice, clean wall the whole way down, because fiber is gonna act like little scrubbies and help keep things clean, keep things moving, keep things lovely. So remember that nice empty nylon stocking there? That's your intestine on fiber. I can't put the entire burger in there, so we're gonna rip it up like we've had a few bites of it. Here we go. So get some burger in there, some fries. As we're digesting, you can see already, look, this is not as clean and neat as having a high veggie diet. We're gonna try to get it through the gut. You'll see we're already getting stuck because there's just not the fiber in there to move things through in the same way. And it just gets all goobered up in there. But gluten, the first part of that word is glue. So as your body's going through, they use gluten in processed foods to glue things together, to stick things together. So that's what's happening in our gut. Can't forget your phosphoric acid in the form of soda. So let's have a soda with that too. Now we've just created a goobery mess in there, not to mention the high fructose corn syrup that's messing with your metabolism. A gut on processed food with low fiber, low residue, and we've got a gut on whole foods, lots of fiber.